Hi everyone, welcome to week 3 of your Pharmaceutical Career Planning 2 course. This week we're going to be covering chapter 6, which is all about home health care. When we think about home health care, it's kind of self-explanatory in some ways. It's services that are provided to the patient within their home. They frequently refer to this as a hospital without walls. And the idea here is that we're providing the patient with different things that they could be getting in a hospital setting, but they can also get it in the home setting. So we're going to have pharmacy services, nursing services, personal care, rehab, home medical equipment services. For example, I actually have a CPAP machine, which is used for sleep apnea, and that would be considered a type of home health care service. Now, obviously, there's no pharmacy involved with that, but it is considered home health care. There's a lot of specialty home health care programs. These are just a few. Some of them that you may be a little more familiar with, the HIV/AIDS programs, pain management, different types of rehab, breast cancer recovery. My dad actually just had a knee replaced recently, and so that falls under rehab, where they actually have someone coming in and helping him do his exercises and things like that at home, rather than him staying in the hospital longer. So those are all of the things that fall under home health care programs. These are some of the other folks that you might see working with them, as well as some other things that are going to be falling under the home healthcare program. So dialysis, hospice, nutrition, all of those types of things. So the home health care patient isn't necessarily an older or elderly patient. It can be an infant, a child, or an adult. Elderly is the most common, but it is not the only one. There are some sort of limitations that they have, some sort of functional limitations, but so that is what puts them into this home health care cycle. These are just a few things that might fall in there. You've got things like mental confusion, surgical incisions, pain, limited range of motion, difficulty breathing. All of these types of things could be a functional limitation that would require home health care. These are the things, though, that are some of the criteria for home health care, because just because you have one of those functional limitations doesn't mean you're eligible for home health care. A lot of times it depends on exactly what type of therapy is going to be provided, what type of health insurance and reimbursement you have, and what exactly is your support system is like. So a lot of these things are part of that support system. Do you have someone who's there to help you? Things like that. The therapy also has to be appropriate for home. So, there's certain things obviously that you wouldn't necessarily want to do at home, whereas other things you definitely can. The patient has to be stable. They have to be able to be a participant in their care. They have to be able to assist in some manners. They have to be able to take responsibility. They need someone who is able to help them. So all of those things are things that are required in order for you to qualify for different types of home health care. There's a lot of different steps in getting to that point. So a lot of times it starts before they even leave a hospital setting. There's actually a process for the home health care piece when they're admitted into the actual acute care facility. So again, it goes through a lot of things. They're going to obviously check things about your insurance. They're going to look at your medical history, and then they're going to develop a plan. So exactly what's going to happen once you get home and what you're going to be doing. Some of the elements of that care plan include a diagnosis, what kind of medications you're currently taking, what kind of therapy you're going to be having, and what are the goals of that therapy. And then, of course, someone has to be monitoring that. So whether it is a home health care nurse coming into the home, whether it's going in to see a doctor every so much time, things like that. There has to be some sort of follow-up. And it also will include what can the patient do as well as what they cannot do. So pharmacy, fits into this piece in some home health care cases, not all. obviously. But obviously, if the patient's getting some sort of an infusion therapy, that's definitely going to be where uh, the pharmacy is playing a role. So these are just some of the things that the pharmacy might do in a home health care setting. They might be dealing with oxygen therapy. They might be dealing with, like I said, different types of IV therapy, nutritional therapy. They might be working with wound care. All of those types of things fall into that bucket. So after you go through this chapter, if you have any problems or questions, please make sure that you let me know, and have a great week.